Hi everyone, Ivan here. I want to show you the system that helps healthcare organizations to find care gaps for almost $400,000 over 1,000 patients and generate curated clinical recommendations for patients with complex conditions. The problem is that care gaps are expensive. Missed diabetes screenings, overdue cancer tests, chronic conditions that aren't being managed properly. Health systems lose serious money on these gaps, and patients with multiple conditions often get overlooked. GapEval does two things. It identifies specific care gaps across your patient population and calculates the financial impact. Second, it shows the gaps for each patient, and for complex patients with multiple conditions, it generates clinical recommendations based on established guidelines like HIDIS. Let me show how it works. You start by uploading your data. The system can support multiple data formats for patient uploads, and today I'm using data in FIRE format. So I'm selecting the files. Here are my patients. So here is the patient list view. After the patient's processing, you can see how many conditions, observations, and encounters each patient has, as well as if they have care gaps, what is the severity of those gaps, and what is the complexity. You can filter by gender, by whether they have gaps or not, by severity level, and by complexity. Now let's go to the population insight. So here you can see the financial impact, total patients with gaps, number of care gaps, and dollar value. This helps prioritize which patient groups needs attention first. Here you can see the distribution, how many patients have multiple gaps and which types of gaps are the most common. For straightforward cases, for example, a single missed screening, the action is clear. But for complex patients with multiple chronic conditions, you can ask AI to generate recommendations. Let me pull up a complex case. So I will choose high severity and complex case, and I will pick up this case. So here you see a specific patient with the information about him and the care gaps. And here you can see his conditions, observations, and encounters. Let's generate some AI recommendations for this patient. So here you can see the generated recommendations. The system pulls relevant guidelines from evidence-based protocols. It's querying diabetes management guidelines, HIDIS quality measures, and clinical best practices for managing these conditions together. So you can see that the system identified care gaps for 43,000 for 100 patients, and it's also identified 400,000 for 1,000 patients. This is the kind of ROI healthcare organizations can get when they properly combine clinical knowledge with AI systems. And if you have any feedback on this system, if you're working on something similar or have questions about the approach, drop a comment below or reach out directly. Thank you, and I'm looking forward to seeing you in the next ones.